At the GEC, the Global Education Cluster, we encourage country clusters to collect and analyze data for the areas affected by crisis. And the main goal is to be able to provide information about the situation, affected people, especially children, adolescents, youth, and of course their parents and the teachers, so that the education clusters at country level can draft a better response, prioritize population groups, be able to identify the most relevant activities. And what we recommend as an education cluster is that this is done as a collective effort between the partners under the leadership or the coordination of the country education cluster.
So usually our first question is to try to understand what's the context, what parameters we're working with, what are the shocks that affect the specific context where we're working in, and trying to get a better understanding of what is the crucial information they need to implement an evidence-based response. And once we have defined all this information needs, we try to think of where can we find this information. It may be going to school and interviewing head teacher, interviewing teachers, trying to understand the challenges they face, what they need to do their work in proper condition in this very specific context.
And then the data is cleaned, it's analyzed, and then this is turned into a report which we encourage country clusters to use for their strategy and prioritization of activities.
Because once we have gathered all this data and we're doing all this analysis, we have a chance to all sit together, look at the results, compare, try to understand, try to interpret what population have told us, so that we can generate a common understanding of the most important need for this population and making sure that we can prioritize accordingly.
I think globally we are encouraged to be more evidence-based, to look at what affected people, both children and adults, are telling us about their situation, about their most critical needs. We know that oftentimes we make assumptions about the needs of children and their parents. We think that the priority for them is food, health, wash, nutrition, but what we hear oftentimes directly from the children and their parents themselves is that education is a priority for the short, medium and long term. Need assessments are the way or the tool that are helping us to collect this information, and they can turn these findings into recommendations.
Also, as part of the education in emergency team is of course to make sure that we gather the perception of the children themselves, because this is the first population that we're trying to serve. We cannot assume what this population needs if we don't ask them. And if we want the response to be adequate and to actually enable children to go back to school and to learn, we need to hear from the communities themselves what they need from us to make this happen.